Hi everyone, I'm Jessica Johnson. I decided to do my report on the United States having free healthcare for all citizens. The reason why I chose this report is because I do work in the private insurance sector, and it seems to be a huge debate that has been going on for years in the United States. And with President Obama implementing the Affordable Care Act, it just seems to be kind of a situation that still has not seemed to ease the mind of the citizens of the United States. When I was doing research on universal health care, um, I started kind of asking myself some questions such as, should we require citizens of the United States to maintain a healthcare policy? Um, are they going to be able to afford the healthcare policy even though it's based off their income? Because as we know, even if it is based off your income, there are the debt to income ratios that are out there, child supports, bills, different things like that. Another question is, should we penalize them for not taking health care if it's their decision? And should we make it a free service for all U.S. citizens? You know, um, when we look at universal health care, we think that any and every country should be able to offer it, but that's definitely not the case. There are only 32 countries in the world that do offer universal health care, 33 if you count the United States with the Affordable Care Act. But there are stipulations, which is on the World Health Organization's website, that states what a country needs to have in order to be able to offer universal health care. The different things are the country has to be a strong, efficient, well-run country. They have to have a strong healthcare system. They have to be able to have the financial means to cover the healthcare costs. And they also have to have a good amount of people that do work in the healthcare field that are going to be able to do these jobs, which means there can't be a shortage in providers and nurses and healthcare professionals. So we have to, kind of ask ourselves, is that something the United States has? Being that we're such a cost-driven country, I honestly don't think we could really support a full healthcare, universal healthcare plan. And I think that's why the Affordable Care Act was implemented the way it was. Because when we kind of look at the pros and cons of universal healthcare, we are covering everybody in the United States. They would have access to medical care. Small business owners wouldn't have to offer insurance, which is a financial burden off them. It would be a financial burden off the patient, and they wouldn't, be required to pay any medical bills because with universal health care, there's no financial burden to the member or the patient. It all falls on the country. So then when we look at the cons of the situation, we have private insurance companies who are going to go out of business because there's no need for insurance anymore. That means thousands upon thousands of people are going to end up losing their jobs. That's insane. So then we're just putting ourselves right back into an unemployment crisis. And then we look at the fact that we're going to have a provider shortage because we are such a cost-driven country. Providers aren't going to want to go to college for 8 years and study only to make bare minimum versus prior to being a universal health care country, they were making a lot more money than the rest of us were. So I guess, the final question is here, should we offer universal health care coverage? Are the benefits, greater than the consequences? And so when I started looking a little bit further, the United States tends to spend $600 per person, which, if you think about it, per person, that's a lot of money, which is twice that of Britain on healthcare costs. Yet, the life expectancy of an American is half that, or shorter than that, of a United Kingdom citizen. A lot of this is because these causes in the United States are easily prevented. Well, the United Kingdom does have a universal healthcare system, and these patients are able to go see healthcare providers at no cost. And previously, prior to the Affordable Care Act, patients were in the United States were not able to because we had copays and cost share and everything like that. Well, looking at the Affordable Care Act and working with the Affordable Care Act for the last 5.5 years, I do see the benefits of the Affordable Care Act because patients are now starting to go see providers more for these preventive visits because there is no cost share. Certain medications are not covered anymore with cost share, such as contraceptives and smoking cessation prescriptions and stuff like that. You have to meet certain criteria to obtain them. However, if you do meet that criteria, then it's at no cost share to you, which is actually a benefit. So when I was looking, at the pros and cons of universal health care, and then I was looking at the Affordable Care Act, I think the Affordable Care Act is the perfect balance for the United States because we are such a cost-sharing country. And we want everybody to have health insurance, but we don't want people to lose their jobs, and we don't want, a shortage of providers. So we kind of have to balance it out, and that's what the Affordable Care Act does. And a lot of people, I think, don't realize that and haven't done their research. When it comes to universal health care, they automatically assume that everything should be covered, and that's not the case. We, need to look at the situation from every aspect and weigh the pros and weigh the cons, I should say, when it comes to universal health care. And the Affordable Care Act, in my opinion, is probably the perfect universal health care plan that we could have in the United States, considering the type of country that we are. We are a strong country. Our economy has seen an uprise. We seem to be doing a lot better than we were many years ago, and with the Affordable Care Act and people now being able to get insurance, with no stipulations, there's no more pre-existing conditions and stuff like that. I think it is a good downright, universal health plan for the United States to benefit, the citizens of the U.S. I hope you have a great night. Thank you.